Hi everybody, it is Carolyn in sunny Virginia Beach, and as you can see out my car window, it is not sunny. Getting kind of tired of this. I'd really like for the sun to come and stay. At least I'm not wearing 14 layers of clothes, there's no snow on the ground, it is not actively raining. And that's my positivity for the day. So, I am at 5 weeks and 1 day today of having 24 teeth removed from my head under force and full upper and lower dentures installed. Here's where I'm at on that. I can eat pretty much anything now. Yay! I had Doritos, Fritos, a pork chop. I have knocked down pretty much everything that I did not think I would be doing at a month in, and well, a month and a week, almost a month and a half, almost. And not only that, but I'm now eating food that I was not eating before I had dentures. Isn't that interesting how that works out? And I want to talk today about positivity, because you too can eat Doritos and Fritos and stuff you couldn't eat before you had dentures. Didn't even think about that, huh? You're all worried because you're like, oh, I don't know if I can eat steak in the first week. No, you can't eat steak in the first week, but you can eat Doritos at week 5. How about that, apples, huh? Them apples? Those apples? I don't even know what that is. How about them apples? What the hell does that mean? I'm going to have to Google that stuff when I get out of here. All right. So, let's talk about positivity. See a lot of new people on Dan's. Welcome, 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 welcome. And congratulations on your decision. And even if it wasn't your decision and your dentist said this has to happen, congratulations, because you are just about to be pretty freaking happy. Not really interested in being happy? Too bad, you're going to be happy. So, I see some people fixating on things. Fixating on what the needles are going to be like, and you're fixating on, you know, can you eat steak in the first week, and you're fixating on how much pain is it going to be, and how traumatic are your extractions going to be, and oh my god, should I get knocked out? You know, how am I going to handle this? Am I going to live through? Are you serious? Most of you people have been going to the dentist for years and been submitted to all kind of traumatic procedures. I think you're going to make it through this one just fine. So, a couple things are, as we wait for this car to make the pass. He's not coming around. There we go. Okay, bye-bye. A couple things. I've totally forgot where I was. Positivity. Starbucks Cafe Espresso Frappuccino, which is incidentally half price between 3 and 5 p.m. for the first couple of weeks of May. Doesn't get any more positive than that. Well, other than Doritos in week 5. So I see people fixating on all the horrible things that are going to happen to them on E-Day, which is Extraction Day. Here's how it goes. Whether you get knocked out or whether you don't get knocked out, the whole procedure is going to probably take, at the most, 2 hours. In my case, it was like 1 hour. I don't even think it was a whole hour. But your extraction dentist, particularly if you go to a denture mill like Aspen or Affordable, they're very experienced with ripping all of your teeth out of your head. They're really, really experienced at it. They're so experienced at it that they move very quickly. And they don't do it like in this, you know, you're gonna die way. They just move quick because they're not worried about neighboring teeth. So they're just one right after the other. And they started out, in my case, on this side and went over to this side. And then they went to the bottom and they, you know, and just like that. And boom, and he was done. And I was like, wow. You better go back in there and make sure you didn't forget one. They're super fast. And, you know, if you go to a regular dentist or ortho, something, whatever, or I don't know, endodontist. Yep, those are big words. You go to, you know, any kind of place like that with people who are, you know, dentists. They're going to be pretty quick, especially if you're having them all pulled, because they don't have to worry about anything neighboring. You know, I remember fillings taking an hour because they had to worry about the teeth that were next to those teeth. This isn't going to be a traumatic experience. You're not going to be scarred for life. You're not going to be thinking about this even a week after it happened. You're not going to be like, oh God, E-Day was horrible. It was the worst day of my life. Many of you have been through childbirth. E-Day is nothing. Is nothing. Stop fixating on it. Stop worrying about it. Stop stressing about it. Don't worry about how many medications you might need to take before you go in there. You know, don't worry about how bad the needles are going to hurt. Here's how it works, right? They give you a shot over whatever the site is, back in here, you know, and then they start moving forward. Well, as they're going, the numbing stuff is like spreading out. So as you get about here, you can't feel anything anymore. You know, you can't feel the shots because those areas are already numb. Now, the roof of the mouth one, it kind of sucks, but what does it last? Like 10 seconds? At the most? You'll be through it before you even know it. And then you're going to go, that was really not that bad. Don't even understand why I was so worried about it. So yeah, you're going to probably have a tiny bit of pain from the needles. And that's it. Then you're done. You're totally done. Then you got to worry about things like sore spots and stuff in your dentures and, you know, dumb stuff. I mean, let's think about it. How many of you have abscesses? Got an abscess? E-Day doesn't hurt as bad as an abscess. How about that? See? Stop fixating on it. You're going to be happy when you get all of this done. We get all these teeth out, and you're suddenly healthier, and you can smile all the freaking time, and then you realize, I don't know how to smile. I don't even know what my smile looks like. Here's my advice to you. Go in the bathroom mirror and practice. Just practice. And when you realize that you're not smiling big enough, because you have years of talking like this so that nobody sees your teeth, you know, then you can practice smiling even bigger. And I think that I probably still need to do that, but I do a lot. I'll go in there and I'll be like, hey girl! No, I don't actually do that. Yes, I do. So, it's important for you to be positive. It's important for you not to focus on the little things. It's important for you not to say, oh my God, my dentures don't fit right on day 3. My life is over. Your life is not over. Not over. And if you're in pain on day 3, call your dentist. Go there if they won't answer the phone or if they tell you you don't need to come in yet. Don't let them make you suffer. You should never have to suffer. Even going through a denture mill like Affordable or Aspen. If they won't put you in, go in. I'm sure they don't want you making a scene in the waiting room. Special advice from Carolyn. Don't let them keep you in pain. There's too many people out there who have dentists that bring them right in when they have pain. So that tells you, if you have pain, you should be going right in. Right away. No suffering. Okay? Now, after E-Day, what do you have to look forward to? Happy. Happy. That's what you have to look forward to. Be positive. Don't think about the little things. Somebody says something to you like, oh, you know, I felt my extraction sites for a week afterwards. What that person didn't mention to you is the extraction sites are like a mosquito bite in comparison to what's going on in your mouth right now. Because nobody goes in to get dentures that has good teeth. So we know you got infection. We know you got pain. We know you got holes in your mouth, holes in your teeth, holes in your gums. You got maybe some gum disease going on, or, you know, a couple abscesses going on, or one abscess, or you just got over an abscess. You know, you got some mouth pain right now. You think you got mouth pain right now? You get rid of these, you know, teeth, and you get the dentures in there, the little annoying, whiny pain, and you've heard me talk about it before. I call it whiny pain because it's just something to focus on, you know, and it's nothing compared to what was going on in there before. So, be positive about it. So, yeah, you got some dentures, you got fake teeth, you smile, and people are like, oh, look at your smile, and you're like, they're not even real. Shit. Don't think like that. Be positive. Just be like, yeah, I do got some nice smile, huh? Look at that. Smile. Oh, look at that. I have a great smile. You know why? Because I made the decision to get rid of those crappy teeth. Feel good about it. Be positive. Positive, positive, positive. You will heal a lot faster if you are positive. That's why I think I skated through it. You know, I got lucky. I see some people that did not get lucky. Like, I'm sorry. I have ADD. Mark on Dentures, A New Smile had possibly the worst extraction case that I think I've ever read. Had some deep roots and had a lot of swelling, and he had a lot of problems. Mark, I am so sorry that happened to you. But you know what? Mark has a great smile right now. And Mark is going to forget about that. And he's going to remember how it felt to have bad teeth. And he's going to look in the mirror and he's going to be like, damn, I got a nice smile. I got it going on now. So be positive. It's important to be positive. The more positive you are, the faster you're going to heal. And if you do happen to have a setback, that positivity is going to pull you through. You'll be at week 5 eating some Doritos. Suck down cafe espresso frappuccino. You guys have a great day.